know that still 60% of all deaths in the Western countries are from cardiovascular diseases. And these are mainly lifestyle diseases. And this is really the domain of Ayurveda to reduce hypertension and all the risk factors that lead to cardiovascular diseases. Also, very successful area of treatment with Ayurveda is the reduction of allergies and hay fever and asthma. And also, Ayurveda is very beneficial in pediatric disorders, for example, in ADHS and lymphatism. Who comes for Ayurvedic treatment to the Ayurvedic family practice? Now, the patients who come usually have education above average, income above average, and the proportion between ladies and men is about 4:1, as tonight. And there's very high motivation of patients coming to an Ayurvedic practice. Many patients are very health-oriented. They develop a close patient-doctor relationship. They are individualists, people with lifestyle of health and sustainability. Patients, we have many patients who cannot be cured by modern medicine, and patients who do not trust or criticize modern medicine, and also spiritual seekers come to Ayurvedic practices. Now, practicing Ayurveda is something with a very great variety of treatment opportunities. We have external treatments, we have internal treatments, we have sound treatments, we have intellectual treatments, we have behavioral treatments. So it's psychology, it's physiology, it's environmental science, ecology. So many things can be done in Ayurveda, and it's never a problem that the patient says, oh, I will not take these pills. There's always another treatment that we can use to bring more balance and more happiness to our patients. So learning, studying Ayurveda is really great in the sense that we also get the knowledge of so many interesting treatment possibilities, and also so much of the knowledge of creation, how the creation works. Yes, most important in Ayurveda is pulse reading. Pulse reading is the key to understanding the patient. Pulse reading is the key to self-healing also. And you should try on your own pulse. It's very interesting. There's no two people in the universe who have the same pulse. And I remember instances when I remember a person not from the face but from the pulse. So you should you should take your own pulse. Ladies should take their left hand and their right hand and feel on their left hand, and we always go around the wrist. And there's a little bone on the wrist. You go around from the back, not this way, this way. Other way? Yes. No. Yes, now you got it. Yes, okay. And there's a crest on the bone, and when you drop here, you find the radial artery. Did you find it? Okay. And then you just put your fingers next to each other, and you find the pulsation. Everybody got it? No pulse? Very dangerous. Now just close your eyes and enjoy your pulse. It's the swing of your life. It's the basic vibration of your life. And just by enjoying this basic vibration, This is something very healthy you can do every day. It gives some stability, it gives some inner calmness, and it gives some self-reliance. So start today. Use this pulse reading every day. Even if you're not a doctor, use it and enjoy it. So there are so many practical things. Take this information home and start taking a pulse every day and enjoy the pulse. And very soon you will find, oh, today it's very nice and calm, or today it's not, it's very restless. And then you know what to do. You need more rest. So Ayurveda is a great field of knowledge, and it's so interesting and so helpful. And it opens a completely new book of life, and it expands the knowledge you have gained till now about all the fields of life, and it gives a system to your vision. You can systematize your whole knowledge by studying Ayurveda. So if you're interested, we offer a course, we offer a series of courses on Maharishi Ayurveda for health professionals, and you will receive information about these series of courses now right at the desk, and I hope that many of you will find the opportunity to join these courses. We will learn pulse reading together, and we will learn many of the very, very interesting modes of treatment, about herbal remedies, about different massage therapies, about diet. And the interesting thing is that you're studying to treat patients, but the first patients is always yourself. So Ayurveda is not only for treatment of other people, it's mainly for self-treatment, and this is maybe why most people started medicine or any other health profession. So thank you for listening. Hope you take some interesting information home, and I'm ready for discussion. Any questions? No, that's, I mean, sometimes it's possible to infer from the energetic imbalance that there must be some organic imbalance. But it's never an organic diagnosis, it's always an energetic diagnosis. So it's not a tool to say, oh, this person has breast cancer or this person has an ulcer in his stomach. You can only say there's too much heat, there's something in the connective tissue or in the hormones, which are also kind of energy, that is in imbalance, but it's not possible, at least in the beginning stages, to diagnose organs. But knowing which doshas are in imbalance is very basic, because this is where the organs draw their energy from. And if you know what you learn very soon when you learn pulse reading is where in the physiology the imbalance happens. So it's not only that vata, pitta or kapha is in imbalance, you can find out, is it in the head, or is it in the pelvis, or is it left or right, or is it up or down. So you find out the region, you find out the main system in the body where an imbalance is. So it gives not only clue to which dosha is in imbalance, it also gives a clue where in the physiology the imbalance happens. And this is what helps. And then in a more advanced stage of pulse reading, you can also find out which of the body tissues are also not in balance. And then you have the tissues, for example, blood tissue or bone tissue, and the imbalance of Vata, Pitta, or Kapha. It leads more and more to a Western diagnosis also. But we have to be careful. It's mainly an energetic diagnosis, and once we have this, we talk to the patient. The Ayurvedic diagnosis is threefold. It's darshan, sparshan, and what else? Darshan, sparshan, and I don't know. It's touch, it's hearing, and it's hearing, touching, and watching. Okay, hearing, touching, and watching. So these three go together and make a holistic diagnosis. Well, we will see. If there's a serious attempt to use it professionally after the courses, then it can also be considered to take other people also. I think you should just apply, and then we will see. Okay, so I think this was it. Thank you for coming.